waste management. This is again one of the important topic that every healthcare professional should be aware of. As the world is again, I want to highlight, battling against COVID-19 infection. In today's scenario, even the layman is made to be aware of some of the standard safety measures like hand washing, wearing masks, social distancing, etc. So we are going to see in depth as a healthcare personnel what are the standard safety measures and what is biomedical waste management, what is the significance of these, how do we achieve these protocols, etc. So what are standard safety measures? A set of infection control practices followed in hospital to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non-intact skin, say for example bruised skin, wound, etc. and mucous membrane. Why it is so important? It protects the healthcare worker and also prevent them from spreading infection among patients. So how do you achieve this standard safety measures? By following these protocols. One is hand hygiene, next personal protective equipment use, third is needlestick and sharp injury prevention, fourth cleaning and disinfection practices followed in healthcare system. Next is respiratory hygiene or the cough etiquette, which the public is made to be aware of today. Next, safe injection practices, and last but not the least, biological waste disposal. Coming to the first protocol, that is hand hygiene. It is recommended that healthcare professionals will wash their hands with plain or antibacterial soap and water, or use of alcohol-based gels for decontaminating the hands. So frequent washing of hands with soap and water will prevent the spread of germs from one person to the other person. So when all we should wash hands before and after contact with the patient, after touching blood, body fluids or contaminated items with bare hands, when moving from contaminated body sites to clean body sites during patient care, after touching objects and medical equipments in the immediate patient care vicinity, before eating, after using the restroom, after coughing or sneezing into a tissue as part of respiratory hygiene. Next is use of personal protective equipment. In yesterday's class itself, we saw it as a barrier to protect the healthcare professional from getting infection and also prevent the healthcare professional from transferring infection from one patient to the other. Yesterday itself, we saw what is PPE. It includes the gloves, gown, mask, respirators, goggles, shoe cover, etc. We saw in yesterday's class what is donning and doffing. It protects the caregiver from infectious agent. Say for example, a surgeon will wear the gloves, mask, goggles, etc. while doing surgery, because he may come in contact with the blood, body fluids, which may spurt and contaminate him. Or the full protective gear like this is recommended nowadays for all the healthcare personnel, whoever is attending a highly infectious disease patient like COVID-19. Needle stick and sharp injury prevention. Safe handling of needles and other sharp devices are implemented to prevent exposure of the healthcare workers from blood and blood products. Say for example, accidental poking while handling the blood of an infectious patient like HIV, HBV can cause a risk for the healthcare professional. Used needles should be discarded immediately after use. used needles, lancets or other sharp items should be placed in a leak-proof, puncture-resistant sharp container. I hope all of you would have seen in the labs where the blood is collected. This particular container, which is red in color or marked as biohazard, will be kept, which will destroy the tip of the needle. We should not overflow this container till the rim. By the time it is 3/4 itself, we should empty it and use the new container. Respiratory hygiene, very, very important in today's scenario, because COVID-19 is the infection which spread from one person to other person by droplet nuclei. That means the infected person sneezes, coughs, he releases the viruses which forms the droplet nuclei. When it is inhaled by the susceptible person, he will contract the disease. In today's scenario, we are more frightened to a person who is sneezing and coughing than to a serious atom bomb. You would have seen very many videos where even the animal tries to move away from the man who tends to sneeze, cough, etc. That is the situation we are living today. So this cough etiquette is very, very important. So whenever the person sneezes and cough, covering the nose, mouth with the tissue is very important. Not only that we cover with the tissue, this tissue has to be discarded in the nearest waste receptacle after use. Today what is being recommended is when we sneeze and cough, as usual, we tend to cover our mouth or nose with the hands. So what they recommend today, because when we use our hands, the virus particles will get deposited on the hands. We most often use our hands to do our work, like opening the doors, switching on the fan, lights, etc., or touch any other object. So we are depositing these microbes onto the objects. So when these objects are touched by or handled by other person, we are transferring the infection. So what they recommend today is, instead of covering your mouth or nose when you're sneezing with your hand, it's better to use crook of the elbow, because here what happens, whatever infectious material gets deposited on the elbow, chances of getting it transferred to the other objects is very less. That's the reason this practice is recommended. Washing hands with soap and water immediately after contact with the respiratory secretions, that also prevent the infection. Asking the patient with signs and symptoms of respiratory illness to wear surgical masks. This again, because we are recommended today to wear masks, because when we are sneezing and coughing, when we are wearing the mask, we are preventing the spread beyond the mask to the environment. And practicing social distancing. In today's scenario, you all are aware of handshaking is not recommended at all. Why? Because we may carry the microbes when we are sneezing and coughing to our hands. So instead of using handshaking, namaste and etc. are recommended. These are some of the pictures to practice the cough etiquette. Next is safe injection practices. All the healthcare personnel who give injections should strictly adhere use of disposable syringe and needle. This part has been achieved by all the healthcare professionals all over the world. We use only a disposable syringe and needle, and we use it once and we try to dispose of. For each injection, it is recommended they use a new syringe and needle. Say, for example, 2-3 injections are to be given to a patient. It's better for each injection a separate syringe and needle is used. And also they recommend, suppose you take one vial of medicine with a medicine, only that vial should be used for one patient and it should be disposed of. So using a single vial for multiple patients also is not recommended. Cleaning and disinfection, again, we saw in depth about what is disinfection, what are the types of disinfection, and what are the things that has to be disinfected in a hospital environment. So this has to be followed strictly in patient care areas, common waiting areas, potentially contaminated surfaces or objects such as doorknobs, sinks, toilets, housekeeping surfaces, etc. So these areas should be cleaned routinely with disinfectants, following the manufacturer's instruction for the amount, what dilution we use, and the time of exposure of the disinfectant. The seventh one is the very important method that has to be followed in all the healthcare system, that is the biomedical waste management. If this protocol is not followed and the hospital waste is just like that carelessly disposed, it can cause a serious threat to the public and to the environment. So hospital waste management or biomedical waste management is one of the very strict protocol that has to be followed. If any hospital neglects or they do not follow the protocol, legal action can be taken by the government. That's because nowadays you see in or read in newspapers, most of the biomedical waste like medicines, injections, syringes, needles, etc., dumped in the open lands recklessly by the healthcare or hospitals, and that may pose a serious threat because disease will be spread. Some of these toxic waste may enter into the environment soil pollution. Some of these waste like toxic heavy metals can be absorbed by the soil, then it can enter into the plants and then it can come into our food chain. Say for example, a biomedical waste collected in a lab or something is not handled properly, it will ferment. Say for example, I am a microbiologist, I am doing the culture. The specimen comes to the laboratory for the isolation and identification. I isolate the microorganism using various media. I identify all that, work is over, report is given. What I do with this culture that I isolated, I have to properly decontaminate it. If I don't do it, I allow them to just leave it on the table. What will happen is it will ferment, it will attract the flies. Then the flies may sit on the culture plate. It can move to various other places and carry the microbes to various other places. So this is the kind of threat if the biomedical waste is not disposed properly can happen. So in this biomedical waste, it's one of the exam-oriented question for you, the nursing students. This alone can be asked as a essay or a 5 marks question. Then you have to write about the definition, what is biomedical waste, what are the types of medical waste, what are the sources by which this biomedical waste is generated, what are the effects of this biomedical waste if it is not handled properly, what are the methods available for the disposal of the biomedical waste, and how the hospital manages the biomedical waste. That is how they how they survey the waste, how do they segregate, how they label them, collect them, store them, transport them, and final destination, how these waste is treated. So what is biomedical waste? Waste generated during the diagnosis, testing, treatment, research or production of biological products like vaccines, diagnostic kits, toxins, toxoids, blood products like plasma for therapy, etc. for the use of human and animals. What are the objectives of the biomedical waste management? To minimize the production or generation of the infective waste, to recycle the waste to the extent possible, to treat the waste by safe, environment-friendly, acceptable methods only, adequate care and handling to prevent healthcare associated infection, safety precautions during the handling of the biomedical waste. How do we classify the biomedical waste? So they are classified into infectious waste. Hello, திருப்பி accept கொடுக்கணுங்களா? ரூபேஷ் ఇక్కడ రామా கொடுத்துட்டா சார். So okay, how do we classify biomedical waste? They are classified into infectious waste, pathological waste, shards, pharmaceutical waste, genotoxic waste, chemical waste, waste with high content of heavy metals, pressurized containers like gas cylinders, anesthetic cylinders, etc., radioactive waste. So we'll see one after the other what are these. Infectious waste. Infectious waste suspected to contain pathogens like it can be a bacteria, virus, parasite or fungus in sufficient quantity to cause disease in susceptible host. So what are the examples for the infectious waste? Routine cultures that we do in the microbiology laboratory, stock cultures, we stock it for various research purposes. Waste from surgery on patients with infectious diseases. Say for example, a person is suffering from diabetic foot ulcer which is caused by uncontrolled infection. Amputation of the foot is recommended. So the infectious foot can be drugs. They are first tried in animals where animals are injected with the vaccine materials or drugs. Infected with vaccine materials or drugs. So these animals also will harbor the infectious agents that has been injected. So these are all the categories of the infectious waste. Coming to pathological waste, this consists of tissues, organs, body parts, human fetuses and animal carcasses, blood, body fluids, etc. Then the sharp category, you know, needles, scalpel, blades, knives, infusion sets, broken glass, nails, etc. comes here, which are used for various surgical procedures. Pharmaceutical waste, pharmacy means you all know drugs or medicines, expired unused medicines, contaminated pharmaceutical products, drugs, vaccines, sera, etc. Comes under this category. Chemical waste, it can be in a form of solid, liquid or gas. Various chemicals are used in laboratory for various diagnostic and research purposes. These chemical waste may be non-hazardous. Sometimes it can be hazardous. They may be toxic. They may be corrosive. They may be flammable, reactive, and some of them can be even genotoxic. I'll tell you later what is genotoxic means. Next, genotoxic waste. They are the highly hazardous chemical waste. They may have mutagenic property. That means they can induce mutation in the chromosomes. They may be teratogenic. What is teratogenic? Teratogenic means they have the ability to cause developmental changes in the fetus, or carcinogenic. They can be cancer inducing. So what are the examples for these genotoxic waste? Cytostatic drugs used for the treatment of cancer. Cancer, you know, is a unchecked multiplication of the cells. So in order to arrest the excess multiplication of the cells, static drugs, that means drugs which will arrest the multiplication of the cells will be used. These are called as cytostatic drugs. Not only these drugs, cancer patients who are treated with these cytostatic drugs as well as other chemicals and radioactive materials may release these drugs through their vomit, urine and feces. So this also poses a danger. Next is the waste with high content of heavy metals. It represents the category of hazardous chemical waste, and mostly they are highly toxic. It includes batteries, broken thermometers and blood pressure gauges which contain mercury as one of its component. Next, pressurized containers, gases stored in pressurized cylinders, cartridges, aerosol cans are used in hospitals for anesthetic purpose. We know that ethylene oxide we use for ethylene oxide sterilization method. Oxygen cylinders, you all know, being used in hospital. Compressed air used in some diagnostic or research laboratories. Radioactive waste, we all know all the hospitals has a X-ray machine where X-rays are being used for capturing the images. Not only this, various other rays like beta rays, gamma rays, alpha particles, etc. are being used in the nuclear medicine. That means they are used for the treatment of cancer. So that's about the various categories of biomedical waste. What are the sources of these biomedical waste? Where are they generated? They are generated, you all know, in hospitals, nursing homes, veterinary hospitals, small clinics, dispensaries where medicines are prepared and being distributed, blood banks, animal houses and research institutes. In all these places, biomedical wastes are being generated. What are the effects of biomedical waste? Why we bother so much about treating this biomedical waste? If these wastes are not treated properly, they can cause air pollution, water pollution and land pollution. Air pollution is caused by biological, chemical and radioactive waste. Water pollution is caused when these biomedical waste are dumped in low-lying areas or into the lakes and water bodies. Again, it is caused by biological waste, chemical waste and the radioactive substances. Next is the land pollution is due to open dumping of the biomedical waste such as infectious waste, discarded medicines and chemicals. This is the very common sight that you read often in newspapers. These biomedical waste dumped in the open lands. So heavy metals such as cadmium, lead, mercury, etc., which are there in the waste will get absorbed by the plants and they can enter into the food chain and can cause serious threat to the health of the society. So what are the methods of disposal of biomedical waste? and how they are categorized category 1 to category 10. And category 1 means what type of waste comes under that, and how do you treat this waste. This is the table which tells about this. Category 1 means it refers to human anatomical waste, human tissues, organs, body parts, etc. And how do you treat it? This kind of waste is treated by incineration and deep burial. What is incineration? Incineration means any organic waste like human anatomical waste, it is burnt with very high temperature in a instrument called incinerator, where it is converted into ash. So next is deep burial. Deep burial, you all know, deep pits are done in the unused land. Then the waste is dumped into it. It is buried. Quick lime soil is put over it. Quick lime, and then again another layer of soil, etc. Then category 2 waste, it refers to animal waste, animal tissues, organs, body parts, carcasses, waste generated by veterinary hospitals and colleges, etc. Again, they are treated by incineration and deep burial method. Third category of waste is the microbiology and biotechnology waste. So waste from laboratory like cultures, stock cultures, specimens of live microorganism, cell cultures of the human and animal origin used for research purposes, infectious agents again used for research, waste from production of vaccines, toxins, toxoids, etc. So these how are these wastes treated? Again, by autoclaving. Autoclaving is one of the common decontamination method used by laboratory like microbiology department. So autoclaving is a method used for both sterilization and decontamination. You would have been told about sterilization. Sterilization is the 100% removal of microorganism from the object. It can be a culture medium, it can be a glassware or any other item being used in the hospital. So this autoclaving will be used for sterilization and decontamination. What is decontamination? Suppose a specimen comes to the microbiology laboratory like sputum specimen, feces specimen, urine, etc. for isolation identification. What we do after isolating and identifying the etiological agent from the specimen, how do we dispose the specimen as well as the culture that is growing from the specimen is by decontaminating them in the autoclave. We put them in a container, you place the entire container into the autoclave. Autoclaving temperature timing, you all know, 121 degree moist heat sterilization, 20 minutes exposure for decontamination under 15 lb pressure. So that's about the autoclaving method of decontamination. What is microwaving? Microwaving is nothing but we use microwave ovens in our house for cooking. Similar larger ones are being used in hospitals for decontamination procedures. Incineration, again I told you in the previous slide what is incineration. Coming to category 4 waste, sharp waste. Like needles, syringes, scalpel, blades, mostly the metal items comes under the sharp category. They can be disinfected, they can be autoclaved, again they can be microwaved, they can be mutilated. Sharp items can be put in the sharp container where the sharp end is made into blunt. And shredding. Shredding means what they do is they will dismantle them into small pieces. That's called as shredding. Category 5, discarded medicines and cytotoxic drugs, incineration, destruction and drug disposal in secured landfills. These are the methods used for the treatment of medicines and cytotoxic drugs. Category 5 is the soiled waste. This contains those items which are contaminated with body fluids, dressings, cotton material, plaster casts, bedding and other materials contaminated with blood, and body fluids. They are treated by incineration method, autoclaving and microwaving. Next is category 7, solid waste, waste generated from disposable items such as all the plastic disposable items like catheters, intravenous lines, etc. They are disinfected by chemical, autoclaving, microwaving, mutilation and shredding. Next is the liquid waste, waste generated from laboratory and washing, cleaning, housekeeping and disinfecting activities. Disinfecting by chemical treatment and discharge them into the drains. That is the method of disposal of category 8 waste. Category 9, ash. I told you incineration is nothing but heating the organic waste at high temperature in incineration, where the organic waste is converted into ash. This ash again is disposed in a municipal landfill. Category 10 is the chemical waste used for the production of biological products, chemicals used in disinfection, etc. So chemical treatment and discharge them into the drains for liquids and secured landfill or deep burial for solids. So these are the types of we categorize the waste into 10 groups, and what are the waste that comes under each group and how do you treat them. Steps in the management of the biomedical waste. So we know that waste has generated at various places in the hospital. So how effectively it has to be taken to the final point of disposal, these protocols has to be followed. That means survey where, when, what amount is generated, they should know. How it has to be segregated, they should know. How it is labeled, that means waste has to be labeled with proper labels like whether it is a toxic, whether it is a biohazard, whether it is flammable, etc. Then it should be collected properly, it should be stored in one particular place till it is transported. Then final destination point, it will be treated. So survey of waste generated, different types. So hospitals should know what are the different types of waste generated, how much quantity is generated, where are the points these waste are generated, and types of waste generated, and the amount that the hospital itself can handle by disinfection methods. Each hospital should be aware of. Then segregation of the waste is very, very important. Effective segregation alone can ensure effective biological waste management. So color coding of these bags or the containers is unavoidable as we enter into any hospital. So it is recommended that each waste has to be discarded into a particular colored code container only. Why? Because each category of waste has to be treated differently. So we cannot dump everything into one container. Okay. So if in a yellow bag, what are all discarded? Infectious waste like bandages, gauze, cotton, or any other object in contact with body fluids, human body parts, placenta, etc. These has to go into the yellow bag. Red bags, plastic waste, all the plastic catheters, IV lines, syringes, tubings, etc. should go into the red bag. And in the blue bag, all types of glass bottles, broken glass items, ampules, etc. should go. And black should contain all the sharp items or the metal items like needles without syringes, blades, knives, etc. Labeling of the container again is very important. The patient and the public should know, seeing the labels, what is there, and these labels should be non-washable and it should be prominently visible when it is stuck onto the waste. Say for example, we have symbols to designate each type of waste. This is the inflammable, toxic, whether it is gas bottle, explosive waste, a radiation material, biohazard symbol, corrosive material, and health danger causing material. So these labels has to be stuck to the collected waste container. Collection and categorization of the waste, again while collecting, the person whoever is assigned to collect the waste has to wear the protective gear. He cannot just like that go with the bare hands and collect them. He has to wear the gloves, he has to wear mask, goggles, etc. to protect himself from getting infected while collecting. While sharp items are collected, it has to be ensured that the sharp containers are discarded only in a puncture-proof container or a leak-proof container, etc. Storage of waste. All the waste that are generated at different points should be collected and it should be kept in one place, and it has to be taken away from that place for the final destination within 48 hours. That is, within 8 to 10 hours, it has to be taken in a big hospital, and in smaller nursing homes within 24 hours it has to be removed from that place of storage. And when we are transporting the waste from one place to the final storage place, again trolleys, wheelbarrows should be used. Just like that, dumping into the bags and dragging on the floor should be avoided. And final, okay, the waste is generated at various points. It has been segregated into different types. It has been collected and it has been stored in one common place, and then it is transported to the destination where it has to be treated. So what are the treatments that are done? One is incineration. I told you what is incineration method. Next method is disinfection. Third method is autoclaving. Again, I explained about autoclaving, all that. And next is microwaving. Again, I told microwave oven uses radio waves, which will again help to decontaminate the microorganisms. Then the deep burial method. These are the methods used for the treatment of the biomedical waste that has been generated. So, biomedical waste treatment is one of the important exam-oriented topic for the nursing students. You may get an essay or a 5-mark. Very often, this question is repeated in your exam paper. So, it is a part of standard safety precautions also. It is also a separate topic. Okay. So, accordingly, if they ask it as a standard safety precautions, you have to write less. If they ask about in detail about the hospital waste management or biomedical waste management, you have to write that 7th part of it in